I've been working with veterans now about 20 years. So I started in residency training, rotating through the Phoenix VA hospital, and I immediately was enchanted with the veterans. I felt a very strong connection to them, just their candor, the bluntness, and I've never stopped taking care of them since then. I worked at the VA for a few years, and the system was so dysfunctional that I couldn't stay inside that hospital. But I continued to serve veterans in my private medical practice. And I realized that I was putting them through the gauntlet of all these standard meds, and they weren't responding. Most of them were turning into zombies, And psychiatry, we're very antiquated in our approach. Like, we basically treat each target symptom with a different prescription, right? So when a veteran comes in and initially, rather than saying they have PTSD, years ago they would say, well, I'm having sleep problems, and then they get put on Ambien or something like that. And then they'd mention the next time, well, I'm having some depression, and they get put on Zoloft or Paxil, which are the only two FDA-approved meds on the market. I don't think people realize that, but we only have two FDA-approved medicines for PTSD. So the rest of the medicines that we pummel these veterans with are all being used off-label. They've never been certified to be useful in PTSD, and yet we hammer them with all these different meds. So you can see how quickly this snowballs, where the veteran comes in then the month 3 and says, oh, and I'm also having some psychotics, and I'm hearing voices and nightmares, and so they get put on Zyprexa or some antipsychotic, and then they mention that they're having these relentless nightmares, and they get put on clonidine at night, and then they say that they're having a lot of anxiety and panic attacks, and they get stuck on Valium or Ativan, one of these very highly addictive benzodiazepines. So you can see how quickly this snowballs, where patients suddenly find themselves within a year on 10 to 15 different psychiatric meds, all to treat these various target symptoms. And what veterans were discovering on their own, certainly not with my help, because I didn't understand that marijuana had any value for them, and I was actively discouraging them from pursuing that path. But slowly veterans were teaching themselves about how marijuana seemed to be useful for managing their symptoms. Nobody was arguing it was a cure, but all of them were suggesting that they were getting some relief of their suffering. And eventually I couldn't ignore it anymore. It became so compelling because there were more and more sort of very conservative, high-ranking veterans even, who had never tried street drugs their whole life and were adamant that illicit drugs were not something they would ever embark on. And yet here they were exploring whole plant marijuana for treating their illness.